I'm Dr. Sarah Zielsdorf, and this is Vitamin D Metabolites. If you are listening at home, please listen to this presentation first, followed by my presentation on polymicrobial sepsis. The following presentation includes discussion of naltrexone and LDN. It also includes its use as an off-label treatment for chronic viral and other inflammatory conditions. The learning objectives for this conference includes 1. Define vitamin D resistance. 2. Understand the extensive endocrine dysfunction which occurs with COVID-19 infection. 3. Define vitamin D metabolites. 4. Describe acute kidney injury with respect to COVID-19 infection. 5. Name 3 treatments to restore the vitamin D receptor function. 6. Define the basis for use of LDN for viral infections, such as COVID-19. Vitamin D is a hormone, a very complex hormone with feedback loops and a myriad of effects on different tissues and regulation that is tightly controlled at the level of the liver and the kidneys and the gut and the parathyroid gland. And there is tight regulation to help to maintain homeostatic levels of calcium and phosphate. And so when we're talking about COVID as an immune endocrine disorder, we want to think of vitamin D metabolites as hormones that we are using to tonify or to heal the endocrine system. And so I want to speak generally. Vitamin D is going to be synthesized systemically. It's going to be converted starting from what we absorb from the sun or what we take, so both endogenous and exogenous. And I'm going to speak about COVID therapeutics using vitamin D receptor restorers and TLR attenuators. We're going to talk about that. I want to introduce what are called toll-like receptors, or TLRs. We're going to talk about that. And this is a class of proteins that's a key role in the innate immune system. COVID and long COVID are progressive immune endocrine disorders. Urgent care 25D and 125D treatments are needed for COVID. Calcitriol replacement therapy is an immune hormone replacement therapy. Vitamin D3 resistance arises from AKI, acute kidney injury, reactivated viruses, and xenobiotic drugs. Hydroxyvitamin D therapies, including 25D and 125D, are able to slow and arrest progressive COVID. Our clinical goals include the suppression of hyperinflammation, the suppression of reactivation of dormant viruses, calcitriol replacement therapy to break vicious histopathogenesis cycles associated with COVAN, coronavirus-associated nephropathy. We must have improved drug delivery approaches for 25D and 125D. Therefore, we have been experimenting with 25 and 125D sublingual drops, troches, throat and nasal sprays, and transdermal preparations. We want to provide support, the immune system support and protection of the gut, kidneys, eyes, brain, and beyond.